The Inner Enemy That Causes Depression with Dr. Lisa Firestone. I'm Gina Carvalho, the Director of Communications for the Glendon Association and PsychAlive. Glendon's mission is to save lives and enhance mental health by addressing the social problems of suicide, violence, child abuse, and troubled interpersonal relationships. Please visit us at our website at glendon.org and psychalive.org to learn more about our work. I have a couple of announcements before we start today's webinar. If you have trouble with the audio on your computer, you can go to the top right hand of your screen, click Use Telephone, and then follow the instructions to listen to the presentation through your telephone. You can type questions during the webinar, also on the right hand of your screen. Time permitting, Dr. Firestone will answer the questions, but you can also forward questions to me at Gina, J-I-N-A, at glendon.org, and I will forward them to Dr. Firestone. There are no CEs provided for today's webinar. And now it is my pleasure to introduce our presenter, Dr. Lisa Firestone. She is the Director of Research and Education for the Glendon Association and the Senior Editor at PsychAlive. Lisa Firestone is the co-author of several books, including Conquer Your Critical Inner Voice, Creating a Life of Meaning and Compassion, Sex and Love and Intimate Relationships, and more recently, The Self Under Siege by Routledge Press. Dr. Firestone is a clinical psychologist in private practice and a consultant on management and treatment of high-risk clients. She is also a regular blogger on Psychology Today and the Huffington Post. And you can learn more about Dr. Firestone's work at glendon.org and psychalive.org. Enjoy today's webinar, and here is Dr. Firestone.
Hello, and welcome to this webinar today. You can, next slide please, you can, this is how you can contact us at either Glendon or PsychAlive, and we're also on Facebook and Twitter. And next slide, and then this is myself, Lisa Firestone, and again, you see the Glendon Association PsychAlive. And then let's go ahead and start the webinar. So part one of our webinar is about the facts about depression. So let's just cover some basic facts. First of all, an estimated 1 in 10 U.S. adults reports depression, according to the CDC. So this is a really huge problem in our country, as you can see. Major depression affects approximately 15 million American adults, or about 8% of the U.S. population aged 18 and older in a given year. So again, a very big problem. Depression is one of the top 3 reasons Americans seek medical treatment. So it's one of the most common things that's troubling people enough for them to go for help. And the prevalence of depression for women is roughly twice that for men. So depression is impacting even more women than men in our country. And lastly, depression is the leading cause of disability and the 4th leading contributor to the global burden of disease and worldwide health, according to the World Health Organization. So this is not just an American problem, although I saw a recent study that showed that more people report depression in France than any other country, and we come in number 2 out of 52 countries. Actually, in countries that are struggling much more, or where people are struggling much more with challenges in life in terms of survival, people are less depressed. Isn't that interesting? Okay, next slide. Let's talk about some more facts about depression. Persons 45 to 64 years of age have been found to be more likely to meet criteria for major depression than any other age group. It's working age Americans where we're seeing the biggest problem. By age 18, nearly 25% of all youth in the U.S. will have experienced a depressive disorder. So that's 1/4 of all people by the time they're 18. So this is something that does happen in children. It can happen in very young children. When your teenager's having a really hard time, it's important to get them to help. By the year 2020, depression will be the 2nd most common health problem in the world. So again, a very big problem worldwide. And depression is one of the most treatable illnesses. This is the good news. 80 to 90% find relief. So when people do seek treatment, we do have a lot of good, very effective treatments out there. Next slide. So I would just like to make this a little more personal, not just facts, but talk about some personal people's experience with depression. So here you see the writer, William Styron, talking about his bout of depression. The madness of depression is the antithesis of violence. It is a storm indeed, but a storm of mirth. Soon evident are the slowed down responses, near paralysis, psychic energy throttled back close to zero. Ultimately, the body is affected and feels sapped and drained. This is the experience of people experiencing a major depression. Now let's talk about treating depression. So here's some facts about treating depression. It's critical for people who are suffering from depression to seek care from a licensed mental health professional. So this is different than just the everyday blues that we all talk about being depressed this week. This is a much more serious and debilitating situation. And seeking a health care professional who has training and experience in helping people recover from depression is the best way to get help. Several approaches to psychotherapy, including cognitive behavioral, interpersonal, and psychodynamic psychotherapy, have proven to help depressed people recover. Psychotherapy offers people the opportunity to identify the factors that contribute to their depression and to deal effectively with the psychological, behavioral, interpersonal, and situational causes. Now, medications can also be helpful for reducing symptoms of depression in some people, particularly in cases of moderate to severe depression. And often, a combination of psychotherapy and medications is the best course of treatment. However, given the potential side effects of any use of medications, it requires close monitoring by the physician who prescribes the drugs. And lastly, and really importantly to those of you who have family members or loved ones who experience depression, the support and involvement of family and friends can play a crucial role in helping someone who's depressed. The, quote, support system can help by encouraging a depressed loved one to stick with treatment and practice coping techniques and problem-solving skills he or she is learning in treatment. So friends and family are really important. And for those of you who are experiencing depression, staying connected to other people, really, really important, especially people who are more positive or who bring you up. It turns out when people hang around with a bunch of people who are depressed and talk to their friends who are depressed about being depressed, it doesn't always help. But there are a lot of ways that connecting socially does help. So some more facts about depression treatment. Next slide. In a study with 681 patients with chronic forms of major depression who were treated either with antidepressants alone or psychotherapy alone or with both, it turns out there's a difference depending how you're going to respond on whether you have a history of childhood trauma. So, for instance, having lost a parent at an early age or experiencing physical abuse or sexual abuse or neglect when you were a child. If you had this kind of background, you're going to respond better to psychotherapy alone than to antidepressants alone. And moreover, the combination of both psychotherapy, talk therapy, if you will, and medical therapy, psychopharmacology, if you will, was only marginally superior to psychotherapy alone for those who had had child abuse. So again, for some people, psychotherapy alone is best. For some people, medication alone might be the best. And for some people, they're going to need both. Of the roughly 15.6 million Americans who have major depression, only 21% receive minimally adequate care. And that's a study done by the American Psychological Association. So that's a very sad fact, is that most of the people who are experiencing depression never get the care that they really need or that will be adequate to help them. Okay, let's go to the next slide. So how can we recognize when we need help? What are some signs and symptoms of depression? First of all, persistent, sad, anxious, or empty feelings, feeling like there's just a hole inside of you. Feelings of hopelessness or pessimism, particularly about yourself and your own personal future. Feelings of guilt, worthlessness, or helplessness. Irritability, restlessness. Now, especially in young children, it's going to take more of this irritable, restless. It may look like a child is acting out quite a bit. This is something we see in teenagers as well. So it's important to recognize that this may be a symptom of depression. Loss of interest in activities or hobbies once found pleasurable, including sexuality, eating, being with friends. Fatigue and decreased energy, that feeling that William Styron was describing. Difficulty concentrating, remembering details, making decisions. You may notice this in a friend or a colleague or coworker. Insomnia, either early morning awakening, so you wake up early in the morning and you can't get back to sleep, or for some people, excessive sleeping. They just cannot get out of bed. And so they go from sleeping a regular amount to sleeping maybe 20, 24 hours a day. And also not being able to go to sleep because of the anxiousness and irritability and restlessness. In terms of appetite, there's a change, either overeating, you find yourself trying to comfort or push down the depressed feelings with food, or you lose your appetite altogether and nothing is pleasurable to you. There can be thoughts of suicide and even suicide attempts, or a person losing their life to suicide who's depressed. That's why treatment is so, so important. And if there's also this factor to your depression of feeling suicidal, it's really important to get a treatment that targets suicidality particularly. And you might want to listen to the webinar that we did last month about suicide if that's one of the issues that you're dealing with, either with a friend or family member or with yourself. The other thing is that there's also a lot of physical pain as well as psychological pain to depression. Aches, pains, headaches, cramps, digestive problems. And they don't ease even when you try to do a physical treatment for those specific symptoms. So how does psychotherapy help people recover from depression? Next slide. It can pinpoint the life problems that are contributing to the depression and help you understand what aspects of those problems you might be able to solve or improve, and also how to let go of the ones you can't solve. It helps you identify negative or distorted thinking patterns that contribute to feelings of hopelessness and helplessness that accompany depression, what we would call the critical inner voice. And we're going to talk about some exercises toward the end of the webinar of how you can specifically overcome these critical inner voices. And it also helps people regain a sense of control and pleasure in life. So it is not hopeless, and you are not helpless. You can get help with depression. Okay, so in what other ways do therapists help depressed individuals and their loved ones? They support and involve family and friends. The support and involvement family and friends can play is a crucial role in helping someone who's depressed. Individuals in the support system encourage the person. They are the people who can help take the stress off of the person. And yet, it's a lot of stress on the family or the loved ones of somebody who's depressed. There's a lot of pain in watching a loved one suffer from depression, and it can make caregivers or people around that person feel helpless and hopeless too, and almost like they've experienced a loss, like where's the person I used to know and who's this person who's now in their place. So family or marital therapy may be beneficial in bringing together all the individuals affected by the depression and helping them all learn effective ways of coping, particularly when it's a long-term or chronic problem, because it is very stressful. And sometimes we forget and just focus on the person who is depressed and not the people surrounding them who are being impacted. So what about medications? Are medications useful for treating depression? They can be very helpful in reducing the symptoms of depression in some people, particularly in cases of moderate to severe depression again. And often a combination of both therapy and medication is going to be the best treatment. Now, medication, it's really important that you get the right one. I think a lot of people take one and think, okay, it's supposed to act like an aspirin, I'm supposed to feel better in 20 minutes, and they don't. But for most of the antidepressants that we prescribe nowadays, people have to take them for 2 or 3 weeks to start to see effect. So it takes time, and you have to get the right one for your particular brain chemistry. So it's also something where you have to be really giving good feedback to your doctor and letting them know whether it's working for you, whether it isn't, whether you're sleeping now way too much, or whether you're now feeling so much energy that you're feeling over-energized and not being able to sleep at all. So you really need to give feedback to your doctor for medications to work well. And again, you might have to try more than one, and it's going to take time. And that's part of where you're going to need people to help you, help the depressed person realize they need to stay on track, and they need to take it regularly. That's the other thing. You can't take it days you feel like it and not take it days you don't. That doesn't work in terms of getting an effect in terms of these antidepressants working to reduce depression. Okay, next I'd like to open our first poll. And if you're watching this as a group, I suggest you designate one person as the poll answering person. And this question that I'm asking is, have you or someone close to you experienced depression? So what's your personal experience of this? I'm going to give you a minute to answer, and then I am going to ask, I'll close the poll and share it with you. Okay. Going to wait till we get about 75% of the votes in. So 100% of you said yes. See, this is just so common, if you think about it, that 1 in 10 people are experiencing a depression, it's very likely that you're going to know somebody or have experienced it yourself. So it's not a surprising finding. Now again, just to make this personal, I'd like to share with you this quote from the actor Robert Steiger. Next slide. There it is. Okay, and this is his picture. When you're depressed, it's as though this committee has taken over your mind, leaving you one depressing thought after the other. Part of the depression is though you're punishing yourself for something. Your sense of self, your appreciation for yourself, your respect for yourself disappears completely. It certainly isn't that your mind goes blank. On the contrary, when you're depressed, your mind beats you to death with thoughts. It never stops. So it's basically just beating you to death with critical inner voices about yourself and about other people. It's basically a way that you're torturing yourself. And again, we're going to talk about these thoughts next. So what are we calling the critical inner voice? So first of all, I'd like to define it. And the critical inner voice refers to a well-integrated pattern of destructive thoughts toward ourselves and about other people. The quotes voices that make up this internalized dialogue are at the root of much of our maladaptive behavior. This internal enemy fosters inwardness, distrust, self-criticism, self-denial, addictions, and a retreat from goal-directed activities. The critical inner voice affects every aspect of our lives, our self-esteem and confidence, our personal and intimate relationships, and our performance and accomplishments at school and at work. And it's this inner enemy that is really at the heart of depression. So let's now talk about it's a lighter side of this. And this is a cartoon, and you see the cat on the couch with a therapist looking very much like Sigmund Freud in the chair. And he says, "To this day, I can hear my mother's voice, harsh, accusing. Lost your mittens, you naughty kittens, and you shall have no pie." So these are critical inner voices that we incorporate early in life, either from how our parents felt toward us or how they reacted to us or things they actually said or did, or other significant figures in our early life, peers, older siblings. They're also incorporated from how our parents felt about themselves. And the big take-home message to those of you who are parents at this webinar is that you have to feel good about yourself. That if you don't root out your own critical inner voices, your child will pick them up and feel them as though they're true about him too, him or her. Next slide. We have one more cartoon about this, and this is a Jules Pfeiffer cartoon from many years ago from the LA Times. And it starts off, "I'm a critic. I'm not a book, art, theater, film, music, or dance critic. I'm a Bernard critic, a resident critic who lives inside the brain of Bernard. He wakes up and I tell him, you're late. At the office, I tell him, you're behind. At dinner parties, I tell him, you're boring. When he falls in love, I tell him, you're not good enough. On occasion, he can't take any more reviews and he orders me out of his head. So I rip off my mask and I say, is that any way to talk to your mother?" So this is what we're talking about, this resident critic that lives inside of our head. And we have one last cartoon that we'll share with you. Next slide. Okay, and this refers to what Rob Steiger was talking about there, about how it's almost like a committee telling you all differently bad things about yourself. And this is the way many people who we've worked with have described it. But this is a funny look at it in the cartoon. And you have odd haircut, unfortunate suit, terrible tie, get off my nose. It's almost like there's a whole committee meeting going on in your head pointing out all of your bad traits and maybe even arguing about them. And maybe even arguing about your partner or people you care about and criticizing them, but also then saying, but they would never like somebody like you. So there's a lot of negative thoughts that people are experiencing. So what are some of the common voices or negative thoughts that people experiencing depression? Here's some. You just don't belong anywhere. Next. You're a horrible person. You don't deserve anything. Just look at yourself in the mirror. You're so ugly. No one can stand you. The world is a real mess. Why should you care about anything? Your friends really hate you. Your life is so boring and empty. Don't ever get too happy because the axe is bound to fall. Nobody really likes you. You're an unlovable person. So some more common voices in depression. You deserve all the bad things that are happening to you. Don't you see what effect you have on your family? Can't you see how bad you make them feel? You're always stirring up trouble, bothering people. Why can't you just stay away? You don't care for anybody. You never cared for anybody in your whole life. Don't show anybody how bad you feel. Who do you think you are anyways? You're nothing. Who could love you? You have nothing to offer. You don't deserve anything. Your family would be better off without you. Just stay away. It's the only decent thing to do. So now I'd like to launch our next poll and ask, do you experience these types of voices? Most of them, some of them, none of them? What are these some of the thoughts that you experience personally? So now we've got the poll open, and we'll give you a minute to vote. And if you are living with a person who's depressed, they are probably experiencing a great deal of these negative thoughts. If you are depressed yourself, you're probably experiencing a great number of these thoughts. And again, if you're watching this as a group, I suggest that you designate one person the poll answering person, because then you get your vote in before we have to close the poll and share the results. So we're going to wait till we have about 3/4 of the vote in and then share the results. Okay, so about 23% of you said most of them, 63% said some of them. So again, these are quite common, and then I can't see the percentage on none of them. It's a smaller percentage, though. So the majority of you are saying either most of them or some of them. So again, this is really what we commonly find. Now to share with you another personal quote from an individual who experienced depression. This one comes from Sylvia Plath, who actually lost her life to suicide. I could not sleep, although tired, and lay feeling my nerves shaved to pain. The groaning inner voice, oh, you can't teach, can't do anything, can't write, can't think. I have a good self that loves skies, hills, ideas, tasty meals, bright colors. My demon would murder this self by demanding that it be a paragon and saying it should run away if it is anything less. So this is some of the struggle that she wrote about prior to taking her life. These two sides of herself. There's also a good self that loves things, that experiences life, that experiences joy, that is goal-directed and life-affirming. But there is the self-critical part. So next, I'd like to talk about part 2 of our webinar. And we're going to start with, where do these critical inner voices come from? And how do they get passed from one generation to the next? Next slide. So to understand where they come from, I'd like to start by introducing you to attachment theory. And some of you may be very familiar with this, some of you probably not at all. But attachment theory was originally talked about by John Bowlby, Sir John Bowlby, and he was a British psychiatrist, and he got interested in attachment for a number of reasons. One is that he grew up in a very rich upper-crust British family himself, where each child had their own nanny. The children and the nannies lived on a different floor than their parents. And about 1 hour a day, they were marched down to see their parents. And his closest attachment figure was, of course, his nanny, the woman who took care of him. And when he was 4, his nanny was fired. So he knew what it was like to lose an attachment figure. He was also in England during World War II, and one of the things that was done is that the children in London were taken to the countryside to keep them safe when London was being bombed. And again, this was done with all good intentions, but taking the children away from their parents actually made them get quite depressed. And then he connected with another person, Mary Ainsworth, and she operationalized and defined his work, and he wrote 3 books on attachment. The other thing that was happening around the same time as Sir John Bowlby was doing his work was Harry Harlow was doing his monkey studies in the United States. And for any of those of you who took early psychology classes, you might have remembered Harry Harlow. He's the guy who had the monkeys and showed that if you gave a baby monkey an option between a wire mother and a cloth mother, they much preferred the cloth mother, who they could snuggle up to the wire mother, even if it was the wire mother who fed them. And then you have Rene Spitz, and he was looking at infants and orphanages following World War II, where they got all of their physical needs met, so they were fed and they were changed and so forth, but they didn't have a loving adult who was attached to them or showed particular or related to them on an interpersonal level. And a lot of these infants, even though they were being fed and taken care of, withered and died. They were failure to thrive. So it's really important that we as human beings have social connections from the time we're born. So again, if you do the next click, we have Mary Ainsworth, and she developed a way of measuring attachment between parent and child by creating something she called the strange situation, where a parent brings about an 11-month-old child into a room with toys and lets the child go down and explore the room. And the mother leaves the room and comes back, leaves the room again and comes back, and of course the infants are quite upset when their mother is gone. And what you really measure in the strange situation in terms of attachment is reunion behavior at the second reunion. And we'll talk a little bit about how that looks different for different types of infants. And then we also have the work of Mary Main and Hera Kessie at the University of California at Berkeley, and one more click. And they added on to attachment theory, and this is research now. It's being done all over the world in all different cultures, and there are many important researchers. I just mentioned them because they developed two things, I think, that added to what John Bowlby had originally done in Mary Ainsworth, which is the adult attachment interview, which is an interview you can do with an adult before their baby is even born, and it predicts what kind of attachment their baby is going to have to them pretty accurately, which is interesting. And then they also found a fourth type of attachment that had not been described before, and you'll see that in a minute. Okay, let's move to the next slide. Okay, so we look at categories of attachment. And attachment is a way of describing the relationship between a parent and child. It's not a label of the parent or the child, it's a label of the relationship between them. So the first and most ideal category is secure attachment. And what that looks like in terms of a parent is a parent, next click, who is emotionally available, perceptive, and responsive to the child. And what it looks like in the strange situation is a baby who is upset when their parent leaves, but they can go to that parent and get comforted, and then they can go back down and explore the environment. What it looks like in terms of a parent when you ask them about their childhood in the adult attachment interview is a parent who can tell you a coherent story about their childhood while staying in good relationship to the person interviewing them. And so it's not a matter of how good or bad your childhood was that actually predicts what kind of parent you'll be, and that's the good news to those of us who've had not such ideal childhoods, but it is whether you felt the full pain of your childhood and made sense of it that predicts whether you can be a good parent. Okay, the next category that they found, the first type of insecure attachment we're going to talk about, is avoidant. And this is where a parent is emotionally unavailable, imperceptive, unresponsive, and even rejecting at times. This is kind of an emotional desert, if you will. And the child learns that the best way to get his needs met by this parent is to act like you don't have any. So what this looks like in the strange situation is a child who looks like they're unconcerned when their parent leaves, and they don't go to the parent to get comforted when the parent comes back. They continue to play with the toys. But if you put a heart rate monitor on these kids, they're very anxious while the parent is out of the room, and they feel much relieved when she's back in the room, even though they don't show it in their behavior because they've learned that that doesn't help you get what you want or what you need. What it looks like in adult attachment interviews, when you ask somebody about their childhood, they say, don't remember much before about age 15. It was fine. Next question. They have very little ability to access that material. These are not people who show up in our offices if we're therapists very often, except when they're dragged by a relationship partner who finds them emotionally unavailable. That's when they end up coming into therapy at the demand of their partner. Okay, next most kind of attachment to talk about is insecure, anxious, ambivalent attachment. And what this looks like is a parent who is inconsistently available. Sometimes your parent is there and responsive and perceptive, but other times they're intrusive and more acting out of their needs than what you need or what they needed as a child, even though it may not be appropriate to what you need as a child. So there's all different kinds of reactions going on. What it looks like in the strange situation is the child is very clingy and very upset when the parent leaves. But when the parent comes back, they go to the parent for comfort. They are very clingy, though, and they don't get comforted, so they can't go back and down and explore the toys. This is a child that's learned that the best way to get your needs met by this parent is to cling. If you really stick closely around them, you'll get some of that good part. It's a little bit like why gambling is so addictive, because it's intermittently reinforcing. This is a parent who's intermittently reinforcing. What it looks like in an adult attachment in an interview is somebody who's still very much caught up in the feelings of their childhood. So while you're asking them about their childhood, they launch into their present relationship with their parent. You know, my mother came to visit last week, and she still went to visit my brother's kids, and she didn't come see our children, and blah, 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 blah. And you haven't asked her anything. You haven't asked this person anything about the current situation. You were asking about when they were 5. So they're still very much caught up in their childhood. And the fourth type of attachment, and most concerning, and the type that was found by Mary Main and Eric Hesse, is insecure, disorganized attachment. And what this looks like is a parent who's either frightening directly to the child, or when the child goes to that parent for comfort, they get frightened, and they're disorienting and alarming. They're unpredictable. So there's no predictable strategy to get your needs met by this parent. And what it looks like in the strange situation is a child who does things that are mixed. So they go toward the parent because they want safety when they come back in the room, but then they're afraid of the parent, so they run away. Or one very painful tape I saw was a little boy who cried twice while his mother was in the room, but never went to her, cried in each of the corners of the room. And she never reached out for him either. And then when she left and came back into the situation, he actually tried to run past her and get away from her in the whole situation. So very painful, if you will. Next slide. So if we look at non-clinical or low-risk populations, what we see is that about 55%, next click, to 60%, 65% of people score as being secure, or relationships are scored as secure between parent and child. About 5 to 15% evidence an ambivalent attachment style. That's that clingy type. The avoidant type, where you act like you don't care, is 20 to 30% of the general population. And then in terms of disorganized attachment, it's 20 to 40% of the general population. Now, the reason that doesn't add up to 100, next click, is because when you have disorganized children, you're also given a best fit alternative. And then in high risk, next click, parentally maltreated children, what we see is that disorganized attachment, one more click, is about 80%. So if we look at people with mental health issues, if we look at people particularly with severe mental health issues, or with our prison population, for instance, we see that about 80% to 90% of the prison population actually have disorganized attachment. So what causes insecure attachment? It turns out that unresolved trauma or loss in the life of a parent statistically predicts attachment style far more than maternal sensitivity, child temperament, the social status of the family, or the culture of the family. So isn't that interesting? Unresolved trauma and loss. So again, if those of you are parents or thinking about becoming parents, it's really important that we feel the full pain of our childhood and make sense of it, that we resolve the trauma that we've had. So what's going on when there's unresolved trauma and loss in the life of a parent that could be affecting their child? Well, we'll think about the difference between implicit versus explicit memory. Now, implicit memory, and here's the bicycle, because if I pulled out a bicycle and said to you, ride this bike, you wouldn't think about, it wouldn't feel like you were remembering, okay, how do I ride a bike? You would just get on and know how to ride, because motor memory is implicit, and it's something that is online in our brain from before we get born all the way throughout our lives. So we have implicit memories of things that happen to us very young in life, but when we remember them, we don't feel like we're remembering. So if you were beaten in a room that has a certain kind of wallpaper, and you walk in as an adult to a room that has that same kind of wallpaper, you don't remember, oh, that's the wallpaper that we had in our living room. You just get a yucky feeling and feel like you have to run out of there. It's almost like a flashback, like you're just back in the situation. And this is very different than explicit memory. Next click. Explicit memory is if I asked you to tell me the story of who taught you to ride a bike. You would feel like you were remembering, and you would tell me a story. Now, it may vary in accuracy, but you would tell me a story that felt like a memory. This type of a memory doesn't come online until we're about 3 years old. So we don't have explicit encoded memories that are verbal until we're about 3. Okay, next slide. So what we think is happening in disorganized attachment and how it gets passed from one generation to the next is that if the child's upset, the parent experiences implicit memories of terrifying experiences that may create for them impulsive behavior with their children, distorted perceptions of the child, rigid thoughts and impaired decision-making patterns, and difficulty tolerating a range of emotion in their children. Okay? And I'm going to launch the next poll and ask you, have you heard of the work of Dan Siegel? He is in the forefront of the field of interpersonal neurobiology, and somebody I've been studying with for about the last 7 or 8 years. And he talks a lot about this. And in a moment, I'm going to share with you some of his work. So I just wanted to see if, how many of you were familiar with it. I'll give you a minute to answer. And when we get about 3/4 of the vote in, we're going to share that with you. Okay. Okay. So there's a small percentage of you who said very familiar. Quite a bit said some experience, and or a small and a large percentage not familiar at all. Okay, well, I'm going to introduce you to this. He has a number of good books out there about parenting and about other things, getting to know yourself. One called Mindsight, another called Parenting from the Inside Out, and a newer one called The Whole Brain Child. And then he's just now published a book on teenagers, sort of a manual for teenagers to understand about their brains and for their parents to understand what's going on in their brains as well. So this is his handy hand model of the brain that I'm going to share with you first. And next click. And if you put your hand up and you think about your palm as your brain stem area, which is the base of your brain, and that's the part of our brain that does all the things we don't think about, heart rate, breathing, blood pressure, and it's part of our brain that's the most evolutionarily old part of our brain. And then you put your thumb across, and that is the emotional centers of your brain, your limbic regions, if you will, a part of our brain we have in common with all mammals. And yes, your cats and dogs have feelings, and they also help you feel better. They're one of the things that can be helpful in depression is having a nice, warm, fuzzy animal that you can pet. And then if you fold your fingers over that thumb, that's your cerebral cortex, the evolutionary most new part of our brain. And most highly developed in human beings is the area under our two middle fingernails, our middle prefrontal cortex. And it turns out it's a very important part of the brain, partly because it helps to integrate the brain. It's connected directly to the cerebral cortex. It touches directly on our amygdala, or the emotional centers of our brain, and helps us calm those down. And it also gets messages directly from the body. So it's a very integrative part of our brain. Now, in flip-lid moments, when we, quotes, lose it, we lose the 9 important functions of the middle prefrontal cortex, which is on our next slide. Next slide, okay. The first is it allows us to regulate our body. It allows us to have attuned communication with others. It allows us to have emotional balance, a brake and accelerator that are in smooth connection. It allows us to have response flexibility, to pause before we act, to have empathy for other people, to have self-knowing awareness or insight into ourselves, something you might get with our book, Conquer Your Critical Inner Voice. It allows us to modulate fear, to calm it down when we're afraid, to have intuition, and to have morality. Now, people who have damage to this part of their brain don't become immoral, they just become amoral. They lose their moral compass. And this is a very important part of our brain that we want to keep online. And when we, quote, flip our lid, particularly with our children, it's going to affect their development when our parents flip their lid with us. And it's really important to think of those moments because those moments are really difficult. So I'm going to go in a little bit more into how we develop this critical inner voice by talking about the division of the mind. Now, here I'm talking about the fact that we're all divided, that like Sylvia Plath said, there's a part of us that's goal-directed and life-affirming, that loves life, that goes after the things we want and need directly, and there's a part of us that's self-critical, self-hating, at its ultimate end can be self-destructive. And we believe, and this is a division within all of us. Now, the nature and degree of this division is going to vary a great deal depending on our early life experience, but we all have this division. So it's a matter of who's more than 51% in control of what's going on in our life at any particular moment. And we believe that this division originally stems from parental ambivalence. And what I mean by that is not to blame parents. I'm a parent, as I'm sure many of you are. But as parents, we have mixed feelings about ourselves. There's things we like about ourselves, and there are ways we're self-critical and self-hating. And we tend to extend both of those reactions to our products, to our children. It's hard to feel like anything very good can come from you if you don't feel good about yourself. Now, the positive side of this leads to parental nurturance, but the negative side can lead to parental rejection, neglect, and actual hostility, particularly at moments of stress when we flip our lid. Okay, next slide. Of course, there's also prenatal influences that affect kids. And next click. And there's all sorts of things, from disease and trauma to substance abuse and domestic violence, that affect children, obviously, in their development. Next slide. And there's also, obviously, birth trauma that affects children, because we now know that how our genes get expressed depends on our earliest environment, including before we got born. So what was our mother eating? What was her stress level? Was she depressed? That's all going to affect the baby. And then there's things the baby comes into the world with. their genetic structure, their temperament, the physicality, the sex of the baby. Was this the baby that was wanted? Is this an easy temperament baby that's very easy to soothe? That's going to be much easier on the parent. Or is this a difficult to soothe baby? So temperament is something that we're born with, and those of you who have more than one children know what I mean. Kids don't come into the world a blank slate. But what is the positive side of this self system? Next slide. The positive side of this ourselves comes from a unique makeup of our individual things that we came into the world with, including our genetics and our predisposition and our temperament, along with a harmonious identification and incorporation of parents' positive attitudes and traits, parents' positive behaviors like attunement, affection, control, nurturance, and the effect of other nurturing experiences, other caring adults. And what the resiliency research shows us now, that kids that come out of very difficult situations and do well had at least one caring adult, a grandparent, a friend, a neighbor. Those things make a big difference, and the good take-home message from this is that we can all have an impact on a child. Second, next slide. So this leads us to have this positive side of ourselves has a realistic positive attitude toward ourselves, not an inflated sense of self, but a realistic positive attitude. It allows us, and it also allows us to have a realistic positive attitude towards other people, which is generally compassionate toward ourselves and toward others, which leads to ethical behavior toward ourselves and toward other people. It allows us to go for our goals, the things we need and want in our search for meaning in life. It allows our behavior to be goal-directed. It allows us to have our own moral principles or moral compass and to act with integrity. Next slide. But what about the anti-self? It's also made up of the unique vulnerabilities that we came into the world with, genetically, our predisposition, our temperament, along with destructive parental behavior, misattunement, lack of affection, rejection, neglect, hostility, over-permissiveness. We now know one of the worst combinations in terms of suicide risk is affectionless over-control, where a parent is very controlling but not affectionate. Other factors also impact on the development of this negative side self, like accidents, illnesses, traumatic separation experiences, death anxiety. But we believe at the core of this negative part of ourselves is that we start to parent ourselves, both criticizing ourselves and nurturing ourselves the way we were treated early in life. So we tend to treat ourselves the way we were treated. Now, I'm going to just skip over these next two slides, but if you can just put them up, you will get this PowerPoint afterwards. It goes into more detail about the anti-self, both the self-punishing part of this and what it looks like, and what the self-soothing part is and what that looks like. Okay? So basically, to go to the next slide, there's a continuum of destructive thoughts that we have about ourselves, from mild self-critical thoughts that we all have one time or another to extreme self-hatred, all the way up to thoughts about suicide. These are some examples of those. There's also a continuum of self-destructive behaviors that people engage in, everything from just limiting their life and denying themselves to isolating themselves to substance abuse, which is not immediately life-threatening but which can truncate or shorten our lives, extreme risk-taking behaviors, and actual suicide. And lastly, there's a relationship between these two continuums. How we're thinking about ourselves has a whole lot to do with how we're likely to behave. So there's events that happen to all of us that are stressful. But then there's our thoughts about those events, which represent a filter through which we see the world. And those thoughts influence how we feel about the event, and they influence our behaviors as well. And when the feelings, when we have thoughts that causes us very distressing feelings, those feelings then act back on the thoughts and make the thoughts seem even more real. So when we have thoughts where we're seeing the world through a negative filter, then our feelings are going to get out of whack, and those feelings are going to make us feel like, oh, these negative thoughts are really even more real, and we get stuck in that cycle with depression. Okay, now we're going to go to part 3 of our webinar. So what do we do about this? First of all, we need to identify our critical inner voices. So how can we identify our critical inner voices? We can recognize events that trigger the critical inner voice, like getting on the scale, like trying to do a hard problem at work, having difficulty in a relationship. We can recognize when specific outside criticisms from other people support our critical inner voice by when we have a big overreaction to a negative criticism from a boss, a relationship partner, a parent, a child. It's usually because that's what we think about ourselves. It doesn't mean that that thought is true, but it's a way we think about ourselves. Next. We also can become aware of times we may be projecting our self-attacks onto others when we think our partner hates us, or our boss really disapproves of us, or we think nobody likes us, or all women think this about us, or all men think that. With no real evidence, it may be that we're just projecting ways we feel about ourselves onto other people. And lastly, we can notice changes in our mood. When does it go in our day-to-day life from my life is half full Are my glasses half full? Are my glasses half empty? What is the filter through which I'm seeing the world? So things may change very little in our life, but we may wake up feeling awful because we're now seeing the glass as half empty. Next slide. So how are we going to challenge these critical inner voices? Okay. Next slide. So first I want to share with you some exercises from our book, Conquer Your Critical Inner Voice. And the first one is just visualizing what's the real you. What are your physical abilities? And you can go ahead and write these down. What are your positive qualities? Next. What are your interests, things that light you up, that really spark you? What are some of your long-term goals? And what are some of your short-term goals? Because when we start to identify these, we start to know what is really us. We can look at, is our behavior moving us toward those goals, or is it moving it away from those goals? If it's moving us toward those goals, we're probably more than 51% on the right side of ourselves. If it's moving us away from our goals, we're probably more than 51% against ourselves. Next slide. So the second, that was the first exercise in Conquer Your Critical Inner Voice. Here's the second exercise. It's to take things that you might think of as I statements, like I don't think I'm attractive, I think I'm a pretty stupid person, and put them in the second person. Another click. And see these as self-critical attacks against yourself and put them in the second person to start to get more distance from them and see them more objectively. So instead of I'm not attractive, it's you're not attractive. It starts to bring out the feeling associated with these thoughts, and it starts to give us some separation from them. Then the third exercise, the next one, click, is we have you keep a journal about your critical inner voices. Take 10, 15 minutes at the end of your day and write down any critical inner voices you've had in that second person format. And just write them down. Don't worry about them making sense or being logical. Just get them all out there. And then come back to it. And on the other side of the page, can you write a more realistic, compassionate point of view toward yourself? For example, instead of you're so stupid, it would be, well, sometimes I do struggle with work, but I catch on quickly then, and I usually do a good job. So a more realistic, compassionate, not I'm the smartest person in the world, because that wouldn't probably be realistic either, but a realistic, compassionate attitude toward yourself. It turns out people who have what looks like inflated self-esteem or vanity or what some people might call narcissism, actually on the flip side of it, they feel pretty bad about themselves. That's part of why they're having to remind you over and over again about how wonderful and great they are, because they want you to continue to see them that way, even though they don't really see themselves that way. Okay, next exercise. I wanted to share with you that on our website, PsychAlive, we have a journaling exercise that you can do that helps prompt you and walk you through this process of identifying your critical inner voice, and also walks you through a number of other things that can be really important. And it's a private online journal. We can't access it from our side, so it's completely blind to us. It's also something that is password protected on your side, so if you share your computer with your loved ones, your spouse, your children, for instance, they can't access your journal. So it's a completely private online journal for you. Okay, next slide. And the fourth exercise, or last exercise from our first chapter in Conquer Your Critical Inner Voice, is to look at actions that are dictated by your critical inner voice that you're engaging in your life today, which may be sabotaging you. So if you're trying to lose weight, you might have thoughts like, have another piece of cake. Or if you're trying to get into a relationship, having thoughts like, you should just be on your own, discouraging you. If you're trying to form new friendships, you might have thoughts like, you can't trust anyone, so don't get too close, and then you're pulling away. And then what are the actions? So these are actions you might be actually engaging in. And what would be some examples of taking actions that actually would reflect the real you? So instead of have another piece of cake, you might, after having that thought, say to yourself, but I want to eat healthy and I want to take care of myself, so I'm not going to have that extra piece of cake. Another example. So instead of you should just be on your own, I don't want to be isolated. I'm going to seek out my friends. I care about other people. And instead of not trusting people, I want to stay vulnerable to my close relationships. These people really matter to me. And so I'm going to take actions that really show that by showing them how much I care and taking a chance. So that's the exercise. Now we also have a chapter in our book, Conquer Your Critical Inner Voice, that focuses on depression and helps you identify how the critical inner voice is being triggered perhaps by events or interactions that you have in your day-to-day life. And then it helps you turn those critical inner voices into a more realistic thought about that event now. So that's a very important first exercise just in terms of getting a hold of the critical inner voices that are driving your depression. Next slide. The second exercise in the chapter on depression is how how are the critical inner voices contributing to depression, and how do these voices leave you feeling when you're experiencing them? So again, looking at how they may be driving your depression or keeping it alive, even though you may be trying to break it, and how are they leaving you feeling emotionally? Third exercise. Next click. Okay. This looks at whether you're having negative thoughts along sort of that continuum that I was talking about. So what are some negative thoughts that you're having on critical inner voices that would lead to low self-esteem or that self-defeating behavior? And what is the behavior that you actually engage in based on those negative thoughts that's self-defeating or self-limiting? Then on the second level, do you have thoughts that support a cycle of addictive behaviors? Whether that's addiction to a substance or addiction to food or addiction to work or addiction to even something that can look healthy like exercise, and what are the behaviors that you're engaged in based on those thoughts. And again, in terms of addictions, these thoughts are very tricky because they first seduce you into the behavior, like have that extra piece of cake on your diet, and then once you indulge, they make you feel terrible, like, oh, you're such a jerk, you said you were going to stay on a diet, you never stick to anything, you're such a failure. And so they play both sides of the coin. They're very tricky. And then you feel really terrible, and you try to soothe that pain by eating maybe the rest of the cake to get rid of that feeling. So it becomes part of a cycle. And so what are the behaviors that you're engaging in that are based on these thoughts that support the cycle of addictions? And then lastly, what are the thoughts that you have that might lead to seriously self-destructive behaviors? And what are the actions that you engage in that are based on those thoughts? Okay, next, 7.4 is helping. These are some, a scale that we put, a brief scale that we put in there to help you identify some of the negative thoughts. Because one of the things we found in doing testing of people all around our country and actually now in other countries, and even the scale's been translated into many languages, is that the negative thoughts are not very different, even from country to country and culture to culture. It's pretty amazing. There's a real commonality into the ways that we're self-critical or self-hating. And we put these on there because they might be some you identify with, and you can see how much you may be having them from never to most of the time. But also we're interested, next exercise, in you keeping a journal where you start with the negative thoughts that were on that list, but then you write the ones that are unique to you. So what are some of your critical inner voices about that are making you feel self-denying or like giving up, and what's a more realistic or compassionate thought about yourself? Back to this journaling exercise. Next. Next slide. And then we also look at what are the thoughts you're having that might lead you to isolate yourself. And again, next slide. Then going from the scale to looking at a more realistic thought versus those thoughts that lead to isolation. And again, you can add your own. Next slide. Next slide, okay. Then here are the ones that contribute to more serious depression. That are much more negative and hostile toward oneself and sometimes lead to that agitation feeling that we were talking about in depression and drive a lot of that feeling, as well as self-destructive behaviors that may increase your depression. And getting isolated, by the way, when you're depressed is the worst thing you can do because these thoughts take much more hold of you when you're alone than you're around caring people who care about you, or even just in a public situation to distract yourself. Next slide. And then again, you go from those to journaling about those, writing down the critical inner voices in that second person, and then it's I statements, what you realistically think about yourself, a more realistic, compassionate attitude toward yourself. Next slide. And then we really focus on planning pleasurable activities because one of the very important things for you to do when you're depressed is to start getting active. It feels really hard to do, like you've heard from some of the quotes that I read. It may feel like you're walking through quicksand, but it's really important to keep doing things that used to give you pleasure, even though they may not be giving you pleasure now, to act as if you're not depressed, to get moving again. Physical exercise turns out to be really important, connecting with others, being out in nature, doing things that are going to make you feel better, even though it doesn't feel like they will. So it's important to describe the activities that you can plan to engage in and keep a weekly report of your critical inner voices that try to sabotage your plans to engage in those activities or talk you out of enjoying them, and then really answering back to those critical thoughts that are trying to talk you out of the activity or sabotage you in terms of engaging in the activity, and also then really looking at the ones that are making you feel like you have no energy to do it either. Next one. Next slide. I think I'm going to skip this poll in the interest of time because I want to get to their end material. But do you think you could use these exercises to help you feel better? I think that you probably could, and I would really suggest that even if it doesn't seem like you could, I would give it a shot and see if it doesn't make you feel better. I think it's a good place to start, and I think it can be a healthy adjunct to getting therapy as well and bringing these into session. So now I'd just like to share with you our therapy approach. And our therapy approach is called voice therapy. And when I say ours, I mean that of myself and my father, Dr. Robert Firestone. And it is a cognitive, affective, behavioral approach. It's cognitive because we're interested in the thoughts. It's affective or emotional because we're interested in the feeling behind these thoughts. Again, this is rarely just a cognitive process. There's usually a lot of emotion. And there can be a lot of anger and pain behind these thoughts. And then it's behavioral because we really do focus on changing behaviors. You have to change behaviors to get anywhere in therapy, and it's going to make you feel anxious, but anxiety is a sign that you're actually challenging yourself and that you're moving in the right direction. So this is my father and his original book on the subject of voice therapy. Next slide. And I'm just going to briefly talk to you about the steps of voice therapy. The first is to put your negative thoughts in the second person as though another person was saying them to you. So you're no good, you're a failure, you'll never amount to anything. And as you can see on the picture, in the picture of this woman's face, that starts to bring up the emotion behind those thoughts. The second step is to discuss your insights about where did these thoughts come from. Where in your early life experience did these thoughts come from? And this is not a therapy where we tell the patient, oh, this must be your mother's voice or your father's voice. No, you're the expert. You're the one experiencing them. You're the one who grew up in your childhood. Where did these come from? And sometimes it was a teacher that was particularly nasty, or peers, or older sibling. So it's important to really identify. And the idea here is not to blame others, but to really help you to feel some compassion for yourself. You didn't get these thoughts from nowhere. Next click. The third step is really to answer back to these negative thoughts. Now, sometimes this is done quite emotionally, too. People want to get angry back at what's hurt them. But when they do, a lot of interesting material spills out that they're not quite aware of. Same as when they're saying the negative thoughts in the second person with the feeling behind them. They start with the thoughts they're aware of on the surface, but they often get to much deeper thoughts. And then it's important just to say realistically, what's a more realistic view of yourself? The fourth step is to look at how are these thoughts influencing your behavior. And lastly, to really collaborate with the therapist on planning to change behaviors. That means going against the negative thoughts that are talking you out of behaviors that are in your own self-interest or that are part of your goals. And it also means taking actions that it's not engaging in actions that are self-destructive that the negative thoughts may be urging you to engage in. Next slide. And if you think about it this way, I think it's important. So let's look at the self and the anti-self, as represented here by Max from the Wild Things and the monsters from the Wild Things. And when you give in to your critical inner voices, next click, what you see is that, click again, Megan, is that the voices get bigger. Whoop, nope, too many clicks. Go back. Thank you. Back. Okay. I'm trying to go back to the monsters. Okay, when you give in to your critical inner voices, these thoughts become bigger and bigger and take more control over your behavior. Now, next slide, or next click. But what you need to do is to stand up to these negative thoughts and this anti-self inside of you, if you will. And when you take your own side and act more and more in your self-interest, these negative thoughts actually start to fade into the background, almost like a parent that gets tired of nagging. And you'll feel more control over your behavior, like when Max said to the monsters, I'm going to go. And they said, we love you, so we'll eat you up, don't go. And he said, I'm going anyway. Okay, next slide. So here's 8 ways to actively fight depression. Recognize and conquer your critical self-attacks, like these exercises we've been talking about. Think about what you could be angry at. One thing about depression is it's a lot anger turned inward. And if you can get angry outward, and that doesn't mean be destructive to other people, but it does mean recognize what you're angry about and at least let yourself feel it. It's also important to be active, to be physically active, to not isolate yourself, to be close to other people, to do things you once liked to do even though you don't feel like it. Next. To watch funny TV shows or movies to laugh. It turns out that when we laugh, it tells our brains we're happy whether we really are or not. You can just put a pencil in your mouth and it'll make you smile, not down your throat but across your mouth, because it makes your lips do what you do when you smile. And it's important not to punish yourself for feeling bad, like to say, oh, you're such a bad person because you're so depressed. Next slide. Also, it's important to see a therapist and take medication. So guidelines for continued personal development. Be aware that there's going to be fear that accompanies change and breaking out of this pattern, that you may feel bad, but it feels comfortable and familiar. It's important to realize that your psychological pain and the negative feelings you have are valid. They did come from somewhere. It's important to develop a more realistic view of your parents. They weren't gods or saints, and they weren't devils either. They were somewhere in between. They were real people struggling with their own issues. It's important to differentiate from your family of origin and unlearn old behaviors that aren't working and coping strategies that aren't working, and learn new behaviors and coping strategies that work better. And that's something you could do with our new book, Self Under Siege. And also, it's more important to become aware of aspects or specific defenses that you have against feelings, the way you're trying to cut off feeling. Because while depression feels bad, it's not exactly about feeling, it's about cutting off feeling. And it's also important to recognize the value of friendship. Next slide. And seek your own personal meaning in life, to go after things that have meaning for you. So I'm not going to go through the slide on differentiation, but I'm just going to put it up there for a second. But again, it's differentiating from self-punishing voices, differentiating from undesirable traits in your parents that you see in yourself, differentiating from defensive reactions that you had as a child or adaptations you made that were adaptive in the beginning but are not helpful to you now in your life. And it's formulating and learning to live by your own values. Who do you want to be? What kind of person do you want to be? Next slide. And this is the only appropriate attitude. Put them all up, Megan, on this slide. Open. It's only appropriate attitude to have towards yourself is curious, open, accepting, and loving. No matter what you do, you can do a behavior you don't like, and you can decide to change that behavior, but you should have a curious, open, accepting, and loving attitude toward yourself. Okay, and I'd like to share with you this Healthy Mind Platter from Dan Siegel. These are the 7 things that we need to do every day to have a healthy mind. We need to sleep, have time where we're being physical, have time where we're focusing, time where we're tuning into what's going on inside of us, downtime where we're doing nothing, playtime, and connecting time with other people. Next slide. These are some guidelines for continued personal development. It's important to be generous in all of your relationships, because when we're generous, what makes us feel good. It's important to face the existential realities, the things that we're all facing, and to develop our own appreciation for the mystery of our own existence and the miracle of us being born in the first place and having this precious life. Next slide. I'd like to end with this quote by Albert Einstein. A human being is part of a whole called by us universe, a part limited in time and space. He experiences himself, his thoughts, and feelings as something separated from the rest, a kind of optical delusion of his consciousness. This delusion is a kind of prison for us, restricting us to our personal desires and to affection for a few persons nearest to us. Our task must be to free ourselves from this prison by widening our circles of compassion, to embrace all living creatures and the whole of nature and its beauty. Nobody is able to achieve this completely, but the striving for such achievement is in itself a part of liberation and a foundation for inner security. And lastly, I just wanted to show you our resources. These are the different books that we have on the subjects that I've been talking about today. And this is a film that we have for understanding and preventing suicide for the general public that you might be interested in. We also blog on Psychology Today and Huffington Post. And then we have some upcoming webinars coming up. Next slide. We have one for therapists on helping clients with depression, and we have ones on hardiness coming up in November and in December. One of those is free, and one is, again, for CEs. So lastly, if you'd like to contact us, this is our contact information, and I appreciate all of you attending the webinar today. And again, you'll be getting a copy of this PowerPoint. Thank you very much for taking this time to think about this very difficult subject of depression. Goodbye.